Thank you, Mr. Chairman. Mr. Secretary, current state funds that are driven out to counties to administer drug and alcohol services for Medicaid recipients, I'd like to talk about. Currently, in Beaver County, there is only one inpatient service provider. The good news is that's a highly recognized provider, and that's Gateway Rehab. The bad news is Beaver County Medicaid recipients have no access to those highly acclaimed services, like access to Dr. Neil Capretto, because the county commissioners have failed to reach a contract with that provider. So currently, actually for several years now, the lead agency in Beaver County has forced patients to go into Allegheny County and even into Ohio for services. And now the lead agency wants to spend $8 million in surplus funding to create a new facility. My questions to you are, one, does the department track where Medicaid recipients will go to get these services and how far of a commute that is? And two, do you have any oversight on where those surplus funds can be spent, and whether or not the department has a policy about whether or not creating another service provider is a responsible use of surplus funds?
So I think that the funds that you're talking about are administered on the county level. That's the way the state has chosen to set up that program. I certainly am in favor of providing as much access to people for services as close to their home as possible. I understand that Beaver County had put out an RFP and awarded a contract for services for another facility. I believe that's under protest right now. That at the county level, that's something that they need to resolve. They use reinvestment funds, I believe, right?
Yes.
They use reinvestment funds. So those funds are surplus funds they have from managing services. Certainly be willing to work with Beaver County about expanding access in that area, but ultimately the way the program is structured in Pennsylvania right now is those are county decisions to make. So that's part of the continuum of services we have there. But certainly anything that would improve access and do it in the most cost-efficient manner way possible, I'm willing to have a discussion and advocate for.
Well, thank you. And in your oversight capacity, too, I would ask that in the middle of this opioid epidemic and heroin epidemic, we also look into where these recipients were forced to travel, and if there was a decline in services that were available because of an unreasonable commute. So I would also like to work with you in your oversight capacity. I would like to switch gears to something the gentlelady from Montgomery County was talking about. If the legislature increases funding for intellectual disabilities and autism services, and the legislature directs those funds to address the staffing crisis that the gentlelady was mentioning, Mr. Secretary, what protections can we put in place to ensure that those funds will actually be used for that statutory goal?
So I think in the past when there have been rate increases, there are steps that the General Assembly has taken in concert with the administration to try to ensure that those increases go to direct care workers and the folks providing the services, and not just to the bottom line of any provider or to other parts within that system. We're certainly happy to talk to you about those, putting those steps in place, working with, I know there are a lot of associations who want to make sure that goes to the workers. I want to make sure it goes to the workers, and I think if we work together, there's probably some language we can do that would help make sure that it goes to those workers.
I guess my follow-up question would be, and my concerns are, as the concerns that were mentioned about the funds that were appropriated specifically for reducing the waiting list, yet your unilateral and, I will say, reluctant decision to divert those funds away from their statutory purpose is what I'm most concerned about. If we were to allocate funds for staffing, salary increases, or a rate increase, that the department will utilize those funds for that goal. And I will say that this is on the heels of the last conversation we had in this room, which was about the waiting list funds not actually going to
So
that
I think
goal.
that I'd say that this funding is a little different. It's associated with the waivers, right?
It's the $26.5 million for the waiting list initiatives, although, as the Secretary had mentioned before, we also have a $49 million supplemental included as part of the budget for the current fiscal year. If that supplemental is not funded, that becomes an obligation in 17-18. That's a $49 million payment that we would be obligated to pay prior to making any payments in 17-18 for any
So I'm
initiative.
not sure I'd characterize it as a unilateral decision on my part. I think that there's, as you know, funding needs to be appropriated by the General Assembly, and then the executive branch needs to implement it. So without that funding, I'm not sure I would characterize it as a unilateral decision on my part.